Basically, ang question is there anything to tie up, is there anything to clean up also with the whole Dengvaxia issue? Because, for example, what did it in and its permits was not just anti-vaxxers to be safe. I mean, to be fair. The reality is there were regulatory questions. Sanofi, after we had given out the vaccines to more than 800,000 children, it was only after that fact that Sanofi said na, ay, dapat pala dun lang sa mga nagka-dengue na. And so there were regulatory questions about there. And then also, the regimen for it is a series of shots. And now I'm wondering, do we even know of those na nabigyan na? Did we even track the 800,000? Where are they now? Where are those children who have it? I'm just giving it a fair shake to your question, what might be the technical reasons to go slow on this? Where are we on those regulatory questions? Even the other countries that have given permits, they were very clear, learning from us. Yeah? But given that, before we jump into and just saying, okay, everybody's doing it, let's do it now, is there anything to clean up from that mess in 2019?
Okay, let me answer your second question first. Where are we now on the 800 children? Just to be clear, the monitoring and the surveillance was stopped by the Department of Health. So that was actually a big problem. But mo hininto yung monitoring and surveillance? Less than half of the 800 children were vaccinated during my time. The rest were vaccinated during Secretary Ubial's time and that of Secretary Duque. Kaya nga, kasabay doon yung monitoring and surveillance, pero nahinto yan. However, in the other countries where the program continued, the results are there. It's all in scientific papers that I can send to your office, and the benefits are clearly outlined there. Second, the issue of Sanofi coming out after the vaccine rollout has commenced. Tama po kayo. Maling-mali ang ginawa ng Sanofi Pasteur at that point. Especially so that they were using medical terminologies that can actually be misconstrued by the general public. What was their announcement as part of compliance? There was a follow-up study on the development of a dengue test kit. That was basically the issue. Because Sanofi Pasteur was working with the University of Pittsburgh, because there is no testing kit that is accurate enough to determine a past dengue infection. They came out to announce that the kit that they have developed was used retroactively in the blood samples of the first 43 of the 3,000 remaining blood samples out of the 43,000 subjects of the clinical trial. At ang nakita nga nila, when they announced, they said, protection is very clear for the first 3 years. However, for the seronegative patients, there is a waning immunity after the 3rd year. For the seropositive patients, the result is very good and highly protected. For the seronegative patients, ibig sabihin yung mga hindi pa nagka-dengue, pagkatapos ng 3 taon, bumababa ang bisa ng kanilang bakuna at kung sila ay matamaan ng dengue, 0.0003% of them will have the probability of developing severe dengue in its own definition, which is actually plus 1 day of hospitalization. And that is where the possibility of a booster shot after the testing kit will be used. Unfortunately, hindi na-preempt ng Sanofi Pasteur at bigla silang nag-announce. And the findings which is contained in several documents and the summary na pinutol-putol at yung nakarating nga lang sa atin is yung statement ng severe dengue. So again, that is where the problem lies. No, and now if your question is, are there regulatory corrections that needs to be done? The problem there is the communication aspect of Sanofi Pasteur. Kasi dapat, before nila ni-release yung, clarify nila that it was severe dengue defined old definition of the severe dengue, which actually translates to plus 1 year of hospitalization. And we have to be clear, kasi pag tinitingnan ng mga scientists ang sitwasyon, ang tinitingnan kasi natin doon is the benefits versus the risks. In the Philippines, because this was applicable for countries, they were referring for countries whose seroprevalence is below 70%. Our seroprevalence is actually 87 to 93%. Kaya this does not apply kasi halos karamihan sa atin, especially those who are already going to school, the adults going out to work, have already been infected by dengue at one point in our life, alam man natin o hindi.
Yes,
And that's
Ma'am, pero-
basically the problem if medical discussions are actually brought outside.